What's up, friends? It's Jordan, and you're listening to the I Am More Than podcast. We're a community of multifaceted and imperfect women here to inspire, educate, entertain, and grow together. We're excited you're here to hang with us and happy to have you part of the More Than movement.
I look at pregnancy and birth as a marathon or as, a high level sports athletic event. And we need to prep for that. We don't just send somebody out to pitch a Major League Baseball game for their first time without any practice. It's the same for delivery, right? So even if we're going into surgery, if we see a soccer player, for example, that has a torn ACL in their knee, they get physical therapy prior to going in for surgery because outcomes are better. Same thing needs to happen for delivery. If we are preparing earlier, then we're going to have better outcomes, even if there is an emergency C-section or, an episiotomy or something like that, because the tissue and the body has been prepared.
That was a clip from today's incredible guest, Dr. Marcy Crouch, aka the Down There Doc. She's a pelvic floor specialist on a mission to fill in the gaps in our current medical system. She's raising the standard of care for pregnant and postpartum women everywhere with affordable, accessible, hassle-free resources, education, and comprehensive training. I wanted to get as much value for you guys as possible, and since I'm not yet a mother, I decided to bring on a co-host for another perspective. In last week's episode, More Than a Mom, you got to know the incredible Alan Rose. Now she's here as my co-host to do a deep dive into the world of preparing your body pre-baby and healing properly post-baby. Dr. Marcy explains why she's so passionate about pelvic floor and debunks some of the myths women deal with post-baby. For example, women should never have pain with sex, incontinence, or prolapse, even though these things are often dismissed or normalized by healthcare providers. She empowers moms to become their own advocates through providing them comprehensive information, support, and knowledge to navigate pregnancy, labor, and recovery. In this episode, we dive into ignoring toxic mom guilt, the correlation between mental health and pelvic floor, her experience with IVF, and so much more. I learned a ton in this episode, and I know you will too. If this topic in particular interests you, I encourage you to check out the Down There Doc on Insta for free resources and tune into her podcast, No Mama Left Behind. Now let's get into the episode. I'm excited to hear your story because clearly somebody with a handle, the Down There Doc, has been through some things. So I would love to know where your passion for pelvic floor comes from. What's your story? How did you get to where you are?
Yeah, for sure. It's such a great question. I love telling this origin story. So I am a physical therapist. And I think it's a surprise sometimes to a lot of people to think of physical therapists as people that might be working down in that area in kind of the women's health realm. But I started doing women's health and pelvic floor stuff kind of right out of the gate. I was started grad school. I had just gotten married. None of my friends were getting married. None of my friends were having kids. I didn't even know about pelvic floor, anything. I had no idea. And I remember sitting in an anatomy class our first semester, and the teacher was going over the pelvic floor, and she used an example of a woman who had a very significant vaginal tear during birth. And I remember, y'all, I just sat there and my jaw just dropped down, and I was staring at the picture and listening to her words, and I just could not understand. I just remember saying, "What do you tear during delivery? What is she talking about? What is happening right?" Yeah, it just
My reaction.
it just completely rocked my world. I mean, I remember what I was wearing. I remember where I was sitting. I remember all of it like it was yesterday. And from that point on, I was so interested in this population, this niche of physical therapy, this kind of unique way to use our skills as musculoskeletal experts and rehab experts. And I just became very involved early on in my career as a student in this field. And that's really all I've ever done. After I graduated PT school, got my doctorate, I went right into residency where I focused on women's health, pregnancy, postpartum, pelvic pain, incontinence, all of the things that we do as pelvic floor PTs. And I've been lucky enough to work for some of the best clinics in the country, and teaching. And, now I have my own company, and we do online courses and kind of all these great things. But I tell people all the time, I'm like, don't ask me about your shoulder or your ankle. I'm like, I don't know. I was like, but tell me everything about your vagina. I'm like, I just want to know everything about it. And our focus now is really training and preparing women for delivery. So we have better postpartum recovery and better outcomes for longer periods of time.
Interesting. And do you find that a lot of the women that are coming to you are first time moms, or have they been through this and didn't recover as well as they wanted to and are now coming back for baby number two?
That's such a great question. I think there's been a shift over the years. I would say in the clinic, I see a lot of second time moms or seasoned moms, let's say, because they had not a not so great experience the first time around. They had a pretty tricky, challenging recovery, still experiencing the same sort of issues. They want to get pregnant with baby number two, or they are pregnant with baby number two, or even number three, and they're concerned that the same thing is going to happen again, or that they're going to get worse after. So in the clinic, I think I see a lot of second or third time moms. Virtually, with our online program, we see a lot of pregnancy and a lot of first time moms coming to us wanting more out of their experience in their prenatal journey, wanting to be more informed, wanting to be more equipped, wanting to kind of hit the ground running. And I love that. I mean, I think that's so important. And I wish that everyone would come to us in their pregnancy, whether they have symptoms or not. But yeah, it kind of varies, I think, depending on the setting. And over the course of time, since social media kind of, got big in the last, 5, 6, 7, 8 years, a lot of change with that too. I think people are coming in a little bit more proactively.
Well, Marcy, you mentioned a little bit briefly about the webinar series that you do. So people are saying that
Mhm.
you're democratizing access to this sort of information. So it's such a taboo topic. There's so many
Mhm.
people out there that don't feel comfortable sharing, moms that sort of talk
Mhm.
about this behind closed doors. So could
Mhm.
you tell us a little bit more about what you're doing to get people access to this information?
Yeah, absolutely. And I think there's a really kind of a nuanced point in what you just said, Alan. I think women have been shielded from this type of information during their pregnancies for the thought that it would scare us and it would like freak us out, if we knew what type of vaginal tearing was out there and what what the recovery looks like and what stitching looks like and that sort of thing. So I think for a long time people just don't talk about it. Like when you go to a childbirth class in your hospital, they're not discussing how to safely and effectively push a baby out to reduce the risk of vaginal trauma. They're just not. They're talking about medications. They're talking about, where you go when you go into labor, what door you come in, how to swaddle a baby, when you'll get discharged, kind of all these things that are important. Yes, we need that information. But there's this huge chasm in really vital information and training for moms going into delivery. And so, what we do with our webinar series and with our online courses and our blog and all the content that we put out there is really trying to say, like, okay, knowledge is power, one. Yes, like some of these images could be like a little like scary, especially if like you don't spend a lot of time looking at, pictures of vulvas, like I do. I mean, to me, like a vulva is an elbow, I'm like, I don't care. Like it's perfectly to part to part to part. But, I do understand and respect that, this is an intimate area and there's a lot of, layers to, your genitals and your vagina and like all that stuff. So I get that. But at the same point, we have to equip our pregnant moms with real knowledge in a safe way that doesn't freak them out, but empowers them to understand what their body is about to do and how amazing it is. Really. I mean, birth is a miracle. I mean, it's just on pregnancy. I mean, it's just when you really think about it, it's amazing. And so not to be like, oh my gosh, look what could happen to your vagina. So scary. But be like, okay, these are the things that we need to prep for. These are the things that you need to understand. These are the questions that you need to ask your doctor ahead of time. This is how you prepare, right? Because our outcomes show that women have a higher level of satisfaction with their birthing outcomes and experiences, even if there is a trauma, because they're informed and they understand what to expect versus somebody who isn't told anything. I mean, you would not believe how many women I have seen over the years who had no idea what type of tear they had no idea that an episiotomy was performed, had no idea that there were, the doctor was going to do, XYZ intervention. They just had no idea because they didn't know. And you don't know unless somebody tells you. Like, how would you know? I know because it's my job, but like, you don't know and they don't tell you these things. So
you get trapped a bit too, don't you? Where, giving birth, you're supposed to just know how to do it inherently as a woman. People talk, we've been doing this for generations. Your body tells you what to do. And that's well and good. And of course, there are some natural elements to it, but why would you not practice the self-care of getting more informed about how to do it the best way possible?
Yeah. And I think it's a really, we talk about this a lot too. I think it's a really good point to say, like, yes, we have been doing this for, millions of years, but the way that we're doing it now is not what we were doing millions of years ago, right? We have interventions, we have hospitals, we have insurance, we have time constraints, we have other kids at home, we're working all the time. Like, life is different now. And so our bodies need to adapt to that. And we need to work within the system that we have, whether it's a hospital birth or, at home or whatever the case may be. We need to be able to prepare. And it's the way that we look at it. And from a physical therapy standpoint, I look at pregnancy and birth as a marathon or as, a high level sports athletic event. And we need to prep for that. We don't just send somebody out to pitch a Major League Baseball game for their first time without any practice. It's the same for delivery, right? So like, even if we're going into surgery, if we see a soccer player, for example, that has a torn ACL in their knee, they get physical therapy prior to going in for surgery because outcomes are better. Same thing needs to happen for delivery. If we are preparing earlier, then we're going to have better outcomes, even if there is an emergency C-section or, an episiotomy or something like that, because the tissue and the body has been prepared.
That's fascinating, especially because it's something that isn't spoken about. And I think you have to know to seek that out. And for somebody, let's say it's a first-time mom that's coming to one of your webinars, are you giving them exercises that they can be doing at home to prep their body? Or what does that process look like?
Yeah, really great question. So in the training, the webinar is really designed to be its own training. So in our birth prep one, I have a system that I've developed over the years I call it the 3 Ps. And the first one is perineal massage. So I'll train the woman how to do it. And it's not what you find on YouTube. And it's not doing perineal massage like the nurse doing it as the baby is crowning for the first time ever with Johnson's baby shampoo. Like, that's not what I'm talking about. And then the second is push practice. So we teach women how to actually get the bearing down movement of the pelvic floor so the pelvic floor muscles can get out of the way. A lot of people think that pelvic floor muscles push a baby out. And so we have to like strengthen, do all these Kegels, have a really strong pelvic floor, but it's the opposite. The pelvic floor muscles have to lengthen and soften and move out of the way so the baby can come down. So we teach them how to do that. And then the third P is practice like you play, which is exactly what I was touching on earlier. We have to add in all of these components, labor positions, perineal massage, push practice in an environment that's similar to birth, right? Like, practice that stuff inside lying. Practice it with your partner holding your leg up. Practice it in squatting. Practice it with this breathing technique. See what positions you have the best push in, where you feel, the most supported physically and mentally. Like, so the first time that you're doing it isn't when the baby is coming out in the hospital. You're like, okay, I know that I got a really good push here. And, things change all the time. Like, when you're in labor, you might be like, oh God, I don't want anybody behind me at all. Like, don't touch me, blah, blah, blah. But at least you know what other options there are, and you can go into your kind of bag of tricks and figure out which is going to work best for you at that time.
One thing that you could maybe give advice, one piece of advice to a first-time mom going into birth, what would it be? What's the number one thing she should be preparing?
Oh gosh. What is the number one thing for a new mom going into birth? I think it would be to ask questions ahead of time and have a good team in place prior to labor. And by team, I mean, physical therapy, mental health, lactation support, and home support. Because if we're really trying to help moms heal and recover, a lot of that other stuff has to be in place too. And to just be okay with accepting and asking for help and saying no to some things in terms of like your responsibilities and your kind of full schedule, if that makes sense. But it's like, this is a time for you to really prepare the best way possible, and you can RSVP no to a lot of things to do other things for you, and that's okay, and there's nothing wrong with that. And I think asking for help and doing as much as you can do physically and mentally without feeling like overloaded or anxious about it is so important. I feel like that was like a bajillion things.
No,
I'm like,
that's great. And it's exactly like you said, where you always feel the best about the situation when you go in feeling informed. So I've kind of felt the same way with having a mastectomy. I went in having all of this information, armed with knowing what I want, the type of reconstruction I had. Maybe another reconstruction might have been the best option for me later on down the road, but I was able to confidently make the decision for myself in the moment. And so I think with a lot of healthcare decisions for women, we kind of just do what the doctor tells us. We're always just, they're the experts. My opinion doesn't really matter. And I know as a first-time mom, the number one thing I kick myself about thinking about my birth was, wow, I didn't have to do those things. It was a suggestion and not, this is the only option. And so I wish I had been armed with that information to be able to say, hey, this isn't my preferred choice. And I think a lot of women feel that way, and they have a lot of regret after their first childbirth experience and feel a little bit more empowered going into number two.
Yeah, I would agree with that, and I see that a lot in my practice too, both virtually and in the clinic. And it's interesting because so many moms tell me that, and I think, Alan, I've told you this before too. I've lived all over because my husband's job takes us we travel and move a lot. And it doesn't, the thing that's so crazy is that it doesn't matter where you are. I mean, I've worked in, Los Angeles, I've worked in Portland, I've worked in a suburb of Portland, I live in the South now, I've been in San Francisco. Whether you're in a booming metropolis or a tiny suburb, women say the same thing all the time. It's, nobody told me about this. I wish I would have known XYZ before going into the delivery. I wish I would have had something ahead of time. Why don't they talk about this in childbirth classes? Nobody equipped me for this. Why does my baby have an appointment every single week for 6 weeks? I have one appointment that's, 10 minutes long. And then they're like, okay, see you on your pap smear in a year. It's like,
you can have sex now.
Yeah, you could have sex. You're good. Like, go back to doing don't do anything for 6 weeks and then do everything. It's like, it's just this huge disconnect, and we don't really even expect that. And I think that's what is so surprising to a lot of moms and so debilitating. It's like, all of a sudden we were, being seen every week, and we were at the center of all of this. And then baby comes, and then moms get dropped. And then it's just like, you're out to fend for yourself. And that's it. Oh, and by the way, breastfeed every 2 hours, and, like, make sure you look like you didn't have a baby. And, oh, you have to go back to work right away, but don't go back too soon because then you're a bad mom. But don't, neglect your career because then you're not putting yourself for, like, you can't win. And it's like, you don't know about all this stuff until you've been in it. So I think from a physical standpoint, what happens to our bodies is very surprising, and takes a lot of moms kind of aback when they're dealing with it.
It's so sad that it's so universal that
Yeah.
women everywhere feel that way. And even the women that are in my lives that I know are moms have said it's almost like you have all this attention leading up to having the baby, and people are caring for you in so many ways, making sure you're okay. And then you have the baby and it's like, well, how's the baby? It's never really, the mom is an afterthought. And I think that that's why so many moms struggle in silence, because one, it's just normal that like most moms are feeling this way. And we had spoken earlier too about you even saying when they do go to doctors and they're talking about whether it's the after effects of recovery or it's mental health or however they're feeling, it almost seems like it's dismissed in a way of like, welcome to the club. That's part of being a mom. So I'd love for you to kind of speak on the moms that you do see that are taking action to have these conversations with you after.
Yeah. And I think to give these women a lot of credit and recognition, because it's very hard to bring up a subject to a provider after you've been shut down for so long, and I think this is why, to touch on what you were saying, Jordan, that a lot of moms feel like they're dealing with this alone because they bring it up to their docs or their providers and it just gets kind of brushed under the rug. Oh yeah, normal to pee when you laugh, cough, or sneeze, normal to have pain with sex. Just drink wine. Oh, you're peeing when you run and you can't run anymore. Okay, well, here's a pad, and then it's like, oh, well, is that it? Like, is that just how it's going to be now forever? Yeah. That's, most moms. I mean, if you just think about your, incontinence, which is leaking urine, is one of the number one reasons that women get admitted to nursing homes in their older years. But that incontinence starts after they've had a baby. So they've been dealing with that their entire adult lives. And so but we don't call them postpartum when they're in their 70s and 80s. But that's just, that problem is getting worse and worse and worse and worse and worse over the years, to the point where they're having to be admitted into nursing homes because they can't make it to the bathroom and then they fall and break a hip and all these things. So like, and they've been told their whole lives to just wear pads. That's it. And so when you go to a new provider, like if you come to someone like me, especially if you've had, persistent pain for a long time, or these issues that really affect your life in a very, very profound way and affect your identity as a woman and as a mother, as whoever, you identify as, it's hard to talk about, because the fear is that you're going to get the same response. And so when women come to me, I make it very clear that I'm listening to them and that I understand where they're coming from and that this isn't the way that it has to be. And there are things that they can start to do to change their bodies and these symptoms. So from actionable steps, I don't think it doesn't really matter where you are postpartum. Like, you can be 2 weeks postpartum, you can be 20 years postpartum. There are still things that you can do to mitigate some of these symptoms and at least improve quality of life and your confidence and your identity of who you are.
I think there's a little bit of a toxic culture sometimes within moms when you choose to go help yourself. So you're doing something like a pelvic floor course or going to the doctor. There's this sort of negative club of like, oh, well, this is just, part of the thing. Like, who do you think you are taking that time to go the extra mile to make yourself feel better? What sort of advice would you give to new moms who are struggling with that, who are taking the right choices to, care for themselves postpartum, and they're facing that backlash?
Yeah, don't listen to it. Like, just, it's so much easier said than done. But I think you have to block out the noise and you have to be very selective in who you surround yourself with, especially in postpartum, because people are going to have opinions about everything. And you've probably already experienced it when you were pregnant, right? People giving you opinions about how you look and how big the baby should be and whether you're breastfeeding or not breastfeeding, or if you're going to feed this type of food or that, or what diapers. I mean, you can't even like just wake up in the morning without people having some sort of opinion about that. But it is interesting because there's this, idea of mom guilt, right? We feel guilty when we leave our kids with the sitter so we can go to the gym, or we feel guilty when we, aren't there for something because we need to go to a doctor's appointment or whatever the case may be. And it's ridiculous, but I mean, I feel it too. I mean, I'm there all the time. And there just has to be a point where you have to say to yourself, I am worth it. And I am in charge of this is my life too. And I have to do these things in order to be the type of mom that I want to be, the type of woman that I want to be, the type of friend, the type of partner. You can't pour from an empty cup. You just cannot. I tried doing it for a long, long time. It doesn't work. I mean, it just doesn't work. And we can't be everything to everybody all the time. And the first thing that has to happen is that you have to heal, whether it's mentally or physically or whatever the case may be after having a baby. And whatever that looks like and whatever journey that looks like, you have to take it. You have to, because this is like your life that we're talking about and your sense of self and your future and your kids' future and their kids' future. It's like that saying, we plant the seeds of a tree that will never sit in the shade of. It's like taking care of yourself does that for all of the people in your life and your legacy. And it's, if somebody's going to give you grief about, leaving your kid with a sitter or dropping your kid off at daycare so you can go to the doctor or to acupuncture or go work out or go just walk by yourself for 2 hours, then like get rid of them. Because it's like life is too short, it's too short and you're too important.
Yeah, amen. Snaps to that.
I mean, come on.
And Alan made a comment earlier that I thought was so good when she said misery loves company.
Yes, it
that
does.
I think when you two have gone through this experience and you're still struggling, because I feel like there's moms that even though their children are now 7, 8, 17, whatever it is, never took the proper steps to heal mentally, especially after the fact. It's really easy to look at new moms and just be like, again, welcome to the club. This is the way it is. And like,
stop
you
complaining.
need to put yourself second, essentially. So is it, and it's never too late, I would assume, to go and get the help to really recover from postpartum, right?
Yeah, correct. It's never too late. I mean, this is just like any sort of, musculoskeletal injury for sure. It's never too late. I mean, I have a patient right now who I saw this morning who's in her 70s and she has prolapse. And this is the first time that she's treating it. And she's been dealing with it for 30 years and, she, getting better. And she's like, gosh, man, why did I wait so long? And I'm like, we all do. It's okay. It's like, how are you going to, like, especially in this kind of older generation, right? When we really didn't talk about that stuff back then. But yeah, no, it's never too late. And I think we're starting to see a shift in culture too, with the younger generation of women and moms who, like we said earlier, are doing things that are putting themselves first and choosing not to feel guilty about it. And that's a very hard thing to do. I mean, I still struggle with that. My kids are older and I still feel guilty when I put myself first or do things that I need to do for me. I mean, all the time. It's like you can't win. But it's like you just have to choose not to let it influence your decisions,
I feel like we need to make push prep the number one baby shower gift. Put it on everyone's baby list registry.
That's exactly right. That we have talked about that. That's
the
people
right.
focus so much, on sleep training, all these different things, all the tools and things that you need, but there's just so little emphasis on how to help a mom be a better mom.
Yeah. I know. We always kind of joke about, I'm like, nobody wants another hooded towel. We have plenty of hooded towels. We have plenty of socks that don't stay on. They're very cute. I appreciate a good ruffle, but I would rather have a course to help my body than, a hooded towel. But that's just me.
And you had talked almost about like myths, quote unquote, about like the fact that after you have a baby, like you're going to struggle with having
Mm-hmm.
to pee every time you're
Mm-hmm.
running or laughing or
Mm-hmm.
any part of basically daily living. And then you also brought up pain during sex and
Mm-hmm.
to just have a drink and basically
Mm-hmm.
deal with it, which I think
Mm-hmm.
are two things that unfortunately are probably far too common. So I'd love to
Yeah.
hear one about how women are coming to you with that, and also what are you doing with them specifically to
Yeah.
help?
Yeah, great question. So, just a little bit of background on that. So, from a statistical standpoint, depending on what study you read, it's either 1 in 3 or 1 in 4 women have pelvic floor dysfunction after baby. So, that's a lot. That's a lot of women. And that can include, that's mainly incontinence, prolapse, urinary, and kind of bowel symptoms. Pain with sex, there was a great study that came out that showed 9 out of 10 women have pain with intercourse the first time that they have sex after having a baby. And out of that 9 out of 10, so just as an aside, just want to flip the script and say, like, if that was men, I highly doubt they would be told that it was normal. Just saying. We can talk about that another podcast. That's a whole nother dissertation. But so in that particular study, 9 out of 10 women had pain with sex for the first time. And that same cohort, they talked to again in 18 months, and a quarter of them were still having pain 18 months post. That's over a year of painful intercourse. And let's say that you're, sexually active with your partner a couple times a week, a couple, whatever the case may be. That's a lot of pain experienced on a consistent basis from something that can be easily treated and or prevented. It's a huge problem. And the second kind of, side of the coin of this is that if we take these dysfunctions like leaking, pain with sex, and we present them to our medical providers prior to pregnancy, it's a problem, right? You get
Yep.
treatment, tested for UTIs, antibiotics if you have one, pain meds, whatever. After baby, so the only changing variable is now a human came out of you. Normal, totally normal. You have to just live your life like this forever. Oh, it hurts to have sex? Totally. Like, baby just came out of your vagina and you just ripped it and needed stitches. So here's some crappy lube that I'm going to give you and drink wine. Should be fine. And then the second part is, leaking. You can wear this liner. And then if it gets worse, you can wear this pad. Oh, and if you want to have another baby, it's just going to get worse. But you want kids, so you choose. And that is the narrative over and over and over and over and over and over. When women come to me, what we do is we reverse that story, first of all, and say it is never normal to have pain with sex unless you want to have pain with sex, but it's never normal to have pain with vaginal penetration. And it goes beyond just sex, I should say. Tampons, gynecological exam, any sort of vaginal penetration. I mean, if you were able to wear tampons prior to baby and now you cannot because they hurt too much, that is a problem. That is a major problem. So never normal to have pain and never normal to leak urine ever, unless you have a UTI or something and there's like a bacterial reason, right? That's like making your urine full of blood and it can't stay in your urethra. But it's not, we wouldn't say that that's normal physiology. So like, why the hell now is it normal physiology? So what we teach, as I come off my soapbox and refocus on your question. So what we teach is pelvic floor specific exercises and movements and strategies to increase strength and endurance and support of the pelvic organs so leaking is less. And then we have specific manual therapy techniques and specific pelvic floor stretching and scar mobilization techniques that we do inside the vaginal canal, on the outside, to C-section scars. Basically the same thing that you would get if you went in for shoulder PT. We just do it in a different area. And the same principles apply when it comes to muscle physiology, exercise science, tissue mobility, neural tension, all the things that PTs do. We just do it in a different area, really. And so we teach women how to do these things. And this is what our program really entails. So they can start healing and recovering and kind of backpedal a little bit and get those symptoms under control, and then start to kind of progress up with, more challenging exercises or, whatever their life demands are.
And how long are you typically seeing clients for during recovery?
Depends on what they're coming in for, and kind of how significant the symptoms are. But I usually say I would give yourself a year recovery.
Wow.
I mean, it took you 9 months to grow that baby. 6 weeks is not enough to recover. So 6 weeks is for tissue healing. It's when wounds close. It's when scars are adhered. That's different than recovery. So I say, we need at least 12 months. Now, what does that look like? It's different for everyone, and some people are, running half marathons at 8 weeks postpartum and doing great. So great for you. That's amazing. But it's not like that for other people. And so we need to kind of tailor that, but we really need to be realistic here and help women understand that it's okay that it takes a long time. And 1 year compared to the rest of your life is chump change in the middle, and when we look at it relatively. But I mean, I have women that have been coming to me who have had the same problem since delivery for 5 years, for 10 years, for 8 years. I mean, that's a long time to live with issues that are affecting you both physically and mentally, So it varies. But we will start to see some change I would say, by 6 to 8 weeks, because that's just muscle physiology. But sometimes it takes a little bit longer.
And you brought up the mental component too. When we did our question box yesterday, I had a lot of women writing in, and it was pretty much focused on the mental health aspect of it, because I think especially postpartum depression seems to be almost mainstream now, that so many people experience it, that it's almost not expected, but not surprising. And I'd love your thoughts on what can you do prior and afterwards to kind of mend that if somebody is not willing to have a medical treatment, basically.
Yeah, it's a great question. And so postpartum depression and anxiety, it's so delicate, especially in the wake of what happened recently with the midwife in New Jersey. It's so heartbreaking. So I am not a mental health expert. So I would say, take this advice with a grain of salt. But I think establishing care with somebody prior to your pregnancy and delivery is very, very important. We have a podcast called No Mama Left Behind, and my partner, Allison, is a mental health provider. And that's what she says all the time. She says, get established with a mental health care provider prior to having the baby. So you're already in the system, you're already in their scheduling books. And so you can start to see, somebody either virtually or in person, if things, start to not go well. And there is a difference between baby blues and postpartum depression, and then, the worst, postpartum psychosis. So I would say, there's a lot of support groups out there. I think Baby Blues International is a good one. There's ACOG, American College of Obstetrics and Gynecology, has some really great resources for baby blues and postpartum depression and anxiety. But from a physical side of things, and we talked a little bit about this, Jordan, too, is that we do see a correlation between increased rates of postpartum depression and anxiety surrounding pelvic floor issues and physical problems following delivery. And that's for two reasons. One is it contributes to the feelings of a mom being isolated and not sure if she's normal or if there's something wrong with her body, choosing not to leave the house because of leaking or pain, not participating in social activities because there might not be a bathroom nearby, or can't wear pants because the C-section scar is painful, or in and out of the hospital because of, residual infection or poor healing, or, whatever the case may be. I had a patient who had a grade 4 tear, which is where you tear into your anal mucosa and disrupt the anal sphincter. And she had fecal incontinence for months after delivery. And so she didn't leave her house because she didn't know when it was going to happen. If she had the urge to have a bowel movement, she wasn't able to control it. And she's like, I can't see my friends. I can't go to the grocery store. Just these little things that you take for granted, she wasn't able to do. And so that obviously played a role in her depression and anxiety, right? So there's that one piece. The second piece is where we start to lose the protective functions of endorphins, of being outside, of vitamin D, of getting sunshine, of breathing air. We lose, kind of our like melatonin for sleep, healthy sleep, right? Because we're not being exposed to sunlight and that sort of thing. So there's all of these other factors too that we're losing out on just because we're not able to move our bodies from like a physical standpoint and the way that we are used to. And that can contribute to increased rates of depression and anxiety. So there's lots of factors. And I think starting to link the physical issues and the mental issues is very, very important, because we need to treat it as a multifaceted issue, right? It's not just postpartum depression, or it's not just leaking pee. How are they interrelated, and what do we need to be doing as a team to treat both of them so we keep, supporting moms through the entire recovery process? And the other thing would be too, like there's, medication is always out there, and there's no shame in needing some sort of medication for anxiety or depression. And I think, just being okay with knowing that medication is an option.
Yeah, if women feel like they don't know where to start, maybe they're just in the beginning of their postpartum journey and they're
Mm-hmm.
feeling a little bit lost, where can
Mm-hmm.
they find you? Where can they find other
Mm-hmm.
resources?
Mm-hmm.
What's the starting point there?
Yeah. So I think, just like a little shameless plug for the podcast, No Mama Left Behind is our podcast that I was talking about. And it's a really great place for this is exactly why we wanted to do it, was basically to talk about the mental and the physical side of things. Allison, my partner, is the mental health expert. So she has a ton of great resources on there for moms from a mental health side of things. You can find me for physical stuff. Instagram, I'm on as the Down There Doc. My website is thedowntheredoc.com. You can just Google the Down There Doc. You can Google Marcy Crouch and it should all pop up. The American Physical Therapy Association has a section called the Academy of Pelvic Health, and they have a pelvic PT locator feature. So you can go there and like type in your zip code and it will pull up pelvic PTs in your area. If there isn't a pelvic PT in your area, or you're not able to get to one for lots of reasons, then, virtual stuff is an option. And that's where we can come into with our webinars and our courses and that sort of thing. And then ACOG is a great resource as well. And there's so many great accounts on Instagram too that are evidence-based and that are run by experts. So I would say just like put the filter on when you're looking through social media, because it can get overwhelming. And there are a lot of people with, frankly, bad advice out there. And I think it's important to know where the information that you're getting is coming from. And people send me stuff all the time and they're like, hey, do you agree with this? Is this evidence-based? Is this true? And most of the time I'm like, yeah, it's awesome. This is like a great source and this has been researched and I agree and that sort of thing. So you can always ask me and I'll happily give you my opinion.
And I'll link all of that in the show notes too.
Yeah.
So everyone
awesome.
can go and see those resources.
Yeah.
Now,
awesome.
You two are both incredible, multifaceted moms. And from the outside perspective, make it look easy. I know you both individually, so I know that that's a funny remark to even say, because there's nothing about being a woman, let alone being a mother, that's easy. But I'd love to hear some things that kind of help both of you when it comes to prioritizing you while also being proud of showing up as the mom that you want to be.
You can't pour from an empty cup, and that's something that I remind myself all the time. When you don't have children and prior to that, your time is your own. And you have so much freedom and so much flexibility. Even if you're working a corporate job, you're doing all of these things. And I think once you have a child, they're a bit of the center of the universe and you have to do everything around them. But I always try to remind myself that I need to take care of myself to be the best mother that I can be. And that means not just taking care of my very basic needs of my health, making sure my pelvic floor is strong, making sure I'm going to my follow-up appointments, but it's going to therapy. It's having those moments where, hey, if I need to go do a Botox appointment, feel good, I'm feeling run down, doing things like that, making sure that I'm taking a shower, that I'm putting on regular clothes every day. These very sort of basic things that make you feel like a human and not just a give machine really makes a difference. And, we touched on earlier, there can be a lot of guilt and shaming in the mom community of, oh, well, if you really loved your kid, those things wouldn't matter. And that's just simply not true, because you know yourself better than anyone, and you know what it takes to make you a whole person. And you are a whole person outside of being a parent. And you have to remember that.
Yeah, it's such valuable, good advice. And I wish that I listened to that when I was a first-time mom, for sure. I mean, I'm guilty of it too. I mean, it's still hard for me to put myself first. And I tell moms every day to do it, and like, I get it. And I don't know if you've had the same experience, Alan, but I'm an IVF mama too. And I remember just like going through IVF for 5 years, having multiple losses, having all this trauma, all of this, like follow-up surgeries and appointments and, bouncing around and all these things. It's like mentally exhausting. And then you get pregnant and it's like, okay, now I'm pregnant and now I'm going to have this baby. And you just go from like 5 years of IVF to pregnancy to being a first-time mom. And then IVF again for the second one. And then now you're a mom of two. And so like for me, I felt for so long that my body wasn't mine. And I was just constantly doing things for everybody all the time, even from just a physical standpoint, all the medications and all of this and, all of these appointments. And I just, for years, I mean, until my second was born. And I didn't start doing something for me until he was 1 or 2. And I realized at that point when I started doing that, I was like, okay, I get it now. I understand how important this is. And all of these things, I was like trying to fill the void with other things. And I was trying to, just do too many things for other people and being like, I can do it. I'm a strong, independent woman. I'm able to juggle all these things and wear all these hats. And then finally, I just was like, had a very honest conversation with myself and was like, Marcy, you need to chill out and you need to prioritize and you need to, if this one thing that you do makes you happy and gives you, a sense of self back that is yours and nobody else's, then like that is what you need to do. And you need to honor that and make that a priority. And I did. And it's a non-negotiable for me now. And I think it took me a long time to figure that out. And I wish that I had somebody that was advocating for that for me earlier instead of the other way around where it's like, oh, well, you're an IVF mom. So like you should be with your kids all the time. Like you wanted them so bad and you spent all this money and you had all these losses. And like, why would you ever leave them? Why would you go back to work? Why would you put them in the care of a sitter? Why would you do this? And it's just like, oh shit, I don't know. I was like, I'm just trying to like be me, I'm like, So I feel like another layer sometimes with the IVF stuff, it's just hard. Everything is just so hard. But
yeah, I just made a note when you were saying that too, like with the IVF, it adds that extra layer of complication. Like you have to enjoy every moment. Just be grateful you have a child.
Yeah, for sure. I mean, and I think COVID really kind of brought that to light too, for me anyway. Like life is short and you don't know what's going to happen. And I didn't want to go through the rest of my motherhood and the rest of my career and the rest of my time on this earth as somebody that was miserable. I was like, I just don't want to. And I don't care if my neighbor thinks that I'm a bad mom because I'm leaving my kids with the sitter for, overnight so I can go somewhere with my husband. Like, I don't care. I'm doing it. They'll be fine. Easier said than done. But
I'm sure.
I mean, it happens.
It's just wild. I feel like the layer of mom guilt that is inherent then gets so heightened by others' comments. And a lot of the times I feel like when people say comments too, they're not actually taking the time to like think about how that will actually impact the person that's in that situation.
100%.
And I think it's so important to like, there's many sayings when people are even struggling with anxiety where it's like, well, just make sure you check on your strong friends. And it's the older I get and the closer I get to this phase in my life, I'm like, I need to check on my mom friends. Like, you guys are going through a ton and need as much backup as possible. And I think when you are lucky enough, not even lucky enough, when you have a husband that is doing what a husband should do and is stepping up and helping support, I feel like that's kind of what people are just like, well, at least you have that. Where I feel like you need a whole team of people that can come around and support.
Yeah, you do. I mean, that saying, it takes a village is true.
I'm learning.
It's true. Yeah.
I feel like I'm learning so much throughout this podcast episode that I'm just like absorbing it all in. What is one piece of advice that you would give to a mom that is currently pregnant, worried about going into the delivery process, worrying about after the fact? What is something that you would like to say to her just to kind of ease that up a little bit?
I would say you're not alone. We should be a little bit nervous about something like this. It's a big deal and it's something we've never experienced before. We don't want to be, afraid, but we want to be prepared. And you can never ask too many questions and you can never ask for help, too much. I would say, my goal is to get our programs into the hands of every single pregnant woman, just making it standard of care, just like your appointments with your OB. People should be going through our birth prep just the same exact frequency, I would say. So they can always reach out to us and my team at the Down There Doc. We can always point them in the right direction if we're not a fit for them. There are so many things that we can do to help educate, prepare, teach, train, and we can do it in lots of different ways, that's what's so awesome now about tech and being online, is that we really can reach a lot of women in lots of different places and we can tailor it to their lifestyle. Part of the problem too is that it's hard for moms to make appointments just from a logistical standpoint. It's like you have to do childcare and find sitters and take time off work and, all of these things. And I lost a lot of moms in the clinic when maternity leave was over because they're like, well, now I have to go back to work and I have to take my kids to school and I have to pick them up. And now we have a parent teacher day and I have to be home. So it's like, when do you go in for appointments in the middle of the day? It's like, you can't, especially if your PT is 2 hours away, so the online space really is a way for us to kind of fill that gap and make sure that moms are getting what they need in a way that works for them. So you don't have to go through it alone. You don't need to be freaked out. There's lots of things that we can do and you just reach out and we're here.
And I will link everything, like I said, in the show notes so that they know exactly where to find you. If you go to her and you DM her, just tell her that you listened to the More Than podcast episode and she will know exactly what you're talking about.
You're like, yes, Jordan, send them all. Yes.
We will. We have lots and lots of mamas part of this community and a lot of soon-to-be moms that I think getting this information to them as early as possible seems to be as beneficial.
For sure.
Alan, do you have any other questions before we wrap?
No, I mean, Marcy, I think you covered it all. And it's just so important that women know that the information is out there. And thank you for everything that you're doing to give women access to this and to break those taboos. Because, I know as a mom who had a really traumatic birth experience, I feel so empowered now going into my pregnancy that there are options for me and that I'm not going to have that same bad experience because I'm going to be empowered and I'm going to take the steps that I need to. So thanks for that.
Oh my gosh, I love it.
And Jordan, thank you for having all of us on and putting this together.
Yes,
this was
Jordan. Thank you. An absolute dream. Thank you, ladies. This was awesome. I know it's going to help a lot of women. So thank you very much. If you're loving our pod, please take a moment to follow, download, rate, review, and most importantly, share with a friend. These small steps help us continue bringing amazing content every single week. Make sure you're following us on Insta at More Than Inc. and subscribe to our newsletter at morethaninc.com for exclusive More Than merch drops and info on in-person meetups. We appreciate you chilling with us and are always here to remind you you are so much more than. We'll see you next week.